Okay, so we're starting to let everybody in, and I think there's just a few more people in the waiting room that are still being let in. So it's probably best to make a start so that we can end on time, given it's an evening meeting. Good evening, everyone. My name is Ema Mir, and I'm the CEO of the Asian Resource Centre of Croydon. Welcome to our joint COVID-19 updates on Omicron, protecting yourself and the community and answering your questions. This is a partnership event in collaboration with NHS South West London, Croydon BME Forum, Croydon Neighbourhood Care Association, Croydon Voluntary Action, Croydon Council, and us, the Asian Resource Centre of Croydon. Just to make you aware that this meeting is being recorded and will be uploaded to our YouTube channel and shared with the community. So if you're uncomfortable with being recorded, please turn your video off. Everyone will remain muted. As you can appreciate, it's not possible to conduct a meeting when everybody's mic's on, but you will get ample opportunity to ask your questions later. You can post any questions via the chat facility, and we will give you an opportunity to speak with the panelists yourself in just a little while. Please don't post any links or images in the chat because you might be removed from the meeting. We want to ensure safety first. I would like to thank all of the partners for coming today to put this event on in short notice. We've been receiving lots and lots of questions from the public around COVID-19 and the variants, in particular Omicron. This is why the event has been put together to give the public an opportunity to get their questions answered by public health and the NHS. My thanks goes to all of our partners, but also Joe Austin from the NHS, who's worked incredibly hard to get all this together in very short notice. Thank you, Joe. So I'll just give you a little bit of background. Now, the NHS vaccination programme will be on offer to everyone over 18 with a chance to book a COVID-19 booster by the end of the year. The UK Health Security Agency reported on Friday that there is a significant drop in effectiveness against Omicron variant after 2 vaccinations. However, analysis shows that a third booster, 3 months after the second dose, prevents around 75% of people getting COVID symptoms. Omicron is spreading fast. If we do nothing, the numbers will increase dramatically within a short time, on top of continuing wave of Delta infections, meaning that there will be a significant number of COVID cases by Christmas, with overwhelming numbers very ill by January, topping the numbers we saw in January last year. So the current messaging really is around booking your booster, and you can do that going on www.nhs.uk to protect yourself, your family, and your friends against Omicron. The bookings are currently available for the boosters for all those aged 30 plus 3 months after the second dose, and all the people aged 18 to 29 will be eligible to book a booster from Wednesday, 15th of December. Now, the NHS is working really, really hard to increase the numbers of appointments, which will be loaded onto the system in the coming days and weeks. And if you cannot book immediately, the message is to try later. Some of the vaccination sites are offering walk-in services for eligible people, and waiting times for walk-ins might be quite long. So please do be patient if you choose to do a walk-in. I'll stop there with the background because we do have some specialists and some experts on the panel today who will be able to give you much more educated information than I will on this. Now, my colleague will paste a link into the chat where you can find out where the latest walk-in services are. Now, in usual fashion, we want to start our session with a poll. So I know people are still coming in, and it seems like quite a lot of people still coming in, but let's try doing the poll with the numbers of people we've got in right now. So the poll is up. You should be able to see it in your screen. And people are starting to answer the question, which is, how well are you informed about the latest COVID-19 news? So that's how well are you informed about the latest COVID-19 news? I can see that lots of people are answering. Just a few more left. Okay, so the results currently show, Mamina, are you going to put the results up for me, or shall I read them off? Okay, so the results currently show that 27% of people are very well informed. 62% people are quite well informed, and 12% of people are still not well informed or confused about the latest COVID-19 news. Let's see if we can turn that around by the end of this session. I know the figures are slightly changing as we go along, but we'll move on. So before I move on to our panelists, I'd really like to bring in, first of all, an introduction from our community partners who've come together to put this event on. So our partners on this event are the Croydon Voluntary Action. We've got Croydon BME Forum and CNCA. If I could ask my community partners to introduce themselves, please. I'm not sure if we've got a CVA representative here with us. If you are there, would you introduce yourself, please? Right, okay, let's move on to the BME Forum.
Okay, hi everyone. My name is Andrew Brown, Chief Executive of the Croydon BME Forum. I'm glad to be working in partnership with all the community partners, and well done EMA so far for hosting this as well. Looking forward to hearing what you guys have got to say. And you know, we've got Rachel here, we've got Dr. Agnelo, so please ask as many questions as possible. And this is your time. And once again, thanks for Joe for putting this on at such a short notice as well. So yeah, really looking forward to seeing what's happening today. Thanks everyone.
Thanks, Andrew. And CNCA, please.
Evening everyone, I'm Sumit Vickar, I'm CEO down at Croydon Neighbourhood Care Association. Really just to echo what Andrew said, thanks very much to everybody for hopefully giving up their time tonight and coming along and going away with some good information. I'll be interested to see the results of the polls at the end, and I hope you've all got your questions ready. Thanks, Emma.
Thanks very much, Sue. And I don't want to waste too much time to get the questions in, so I will go straight to asking my panelists for quick introductions and a little update. Today we've got Rachel Flowers, Dr. Agnelo Fernandes, and Becky Board. So if I could start with Rachel Flowers, who is the Director of Public Health.
Thank you very much indeed, although you've actually covered quite a lot really well already. So as you've heard, many of you have heard me over a period of time, we are learning by the day about this part of the pandemic. COVID as a virus does what all viruses do, it changes to survive. We are now starting to see the virus change. We used to use the word mutate. We use the word kind of like variation now, but it is mutating into another version. So what we are seeing within Croydon and within London are two epidemics. We're seeing the epidemic of the Delta variant, which we have had within England, well, actually the 4 countries of the United Kingdom for several months. And we're starting to see a significant change around Omicron. I think many of us just had to check how, 1, we spelt it, and 2, how we pronounced it. I think in terms of Greek classical letters. But joking aside, is that we have only known about this new variant for the last 3 weeks. So I'm pleased that many of you feel that you're informed. I think that this is an ongoing development, is that what we are seeing within London, what I am seeing in Croydon, is a significant increase of numbers of people infected with COVID. The evidence that we have across London is about 60% of cases now are probably Omicron rather than Delta. So we're seeing a switch over. However, what we are also seeing with Omicron, what do we know? We know it is far more communicable. It is doubling, and remember we had the conversation about doubling and R rates. You will have heard Chris Whitty perhaps talk about this last night. Within London, it is doubling in less than 2 days. So every 2 days, the numbers are increasing. The line is going up like a straight line. What we don't know yet, because it is still too soon, is, and it is happening very quickly, what that will mean in terms of the impact around the acute hospital, how many people kind of get poorly. What we are starting to know, and I think the thing is, Irma, you said this, but it is not certain yet, and I think we need to be honest about what we think we know, is that actually two jabs of COVID vaccine may not provide the protection to stop it being communicated that in Omicron that it did within Delta. So it's stopping spreading it. We don't know what the impact is in hospitalization, because part of it is to close this infection down. What we do believe is that with that the third injection, either a third injection if the person is vulnerable, or a booster injection, actually seems to provide more protection in terms of the Omicron, but we don't know in terms of the impact around this. Now, I know there's a range of people in here. I mean, I have been asked to wave hello to those who are caring for people. Huge, brilliant piece of work that you're doing for people. So it's important, not just in terms of protecting vulnerable people, but protecting yourself. So we're working at pace around this, but I will just confirm that what we think might be the case, and we still don't, is that although Omicron might be slightly milder than perhaps Delta, because it's increasing so much faster, is actually there are more people who are likely to be more severely ill around this, hence the importance around vaccinations. And actually, in relation to this, I would urge people, whether they're going for their booster or whether they've been waiting for a first or a second jab, please do get this. Basically, vaccinations work in the fact that they teach the body how to react in an immune way to the virus. Lovely analogy, which I'm going to use because I like it, is that to start off with, the first jab is like when we go to primary school, the second jab is when we go to secondary school, and the third jab is actually taking your body's immune system to university. Actually, it's getting the body prepared in relation to this. So it's still a work in progress, and actually certainly what Chris Whitty said last night is talking about, we're waiting to see. Although we're seeing the lines up like that, we are thankfully not yet seeing significant increases in hospital. I'll be perfectly honest, I think that we might next week, but we just don't know what that might be. I want to be as transparent as we do. There's quite a lot of speculation in relation to that. I hope that's a helpful summary.
Thank you so much. Always very helpful, Rachel. And I love your analogy about taking your immune system to university. I wish I had, because I stopped at the stage before, I'm afraid. We had the conversation just a bit ago, didn't we? That I'm lived experience, because I'm currently going through COVID right now. And I've been isolating in this room for 4 days with my children outside, just knocking every time they want to say hello, mummy, and sending me cards under the thing. So you just cannot downplay the seriousness of this. We have been going throughout COVID as an organization, still being out there helping people, but I didn't feel as vulnerable as I do now with Omicron. So I think I would really support that message, that we need to protect ourselves as best as we can. Our second speaker is the Croydon Borough GP lead, Dr. Agnelo Fernandes. If you would like to give your introduction, please.
Thank you, Emma. Thank you for inviting me. Yes, we are in a difficult position at the moment. But I think the three key messages I want to give really is, this is not a time for panic. this is not a time for being over anxious, and a lot of people are really feeling anxious. You turn the television on, you turn the radio on, you watch Downing Street press conferences, you look at the newspapers, and you think the world is coming to an end. Far from it. And I think that's really key to get across to people, is this is not unexpected. We kind of expected this, and we'll expect it in the future. So this is something, the situation we're in now is one that we need to be aware of, but we need to also get the information from trusted sources about what is happening. So the first key message is don't panic. So in the words of Captain Mannering, don't panic. We are in a good place in this country, and we can be in a better place. We know that COVID and the Omicron virus variant can cause problems, and all those of you who've had COVID, including myself, know the impact of it. And so yes, it can be serious, but it is something that we have to live with, but it's not something that we should spend our waking days and nights worrying about, because that will just cause us more problems, and our mental health is important as well. Trust in the sources of information that you get. Secondly is, yes, this is happening. What could we do to help ourselves? I think there are certain things we can do to help ourselves. Follow the guidance. Hands, face, space, and fresh air, absolutely critical. And we can do that to protect ourselves, our families, and people around us. So it's important that we follow that guidance to minimize being infected, no matter how infectious the variant is. And we know that Omicron is more infectious than Delta. And we've come through Alpha, we've come through Beta, we've come through Delta, and now we've come to Omicron. And there'll be another one afterwards. So this is just part of the road that we're on, but it's not a time to panic. It's a time to think about what can we do to help ourselves, starting off with simple measures that we can all do, which is not going to restrict us. The second and most important is, what can we do to prevent getting the virus and prevent becoming seriously ill if we do get it? And so important to get the vaccination, the COVID vaccination. And unfortunately in Croydon, we're still about 60% in parts of the borough that have had the vaccine, so there's at least 40% who haven't. And overall in Croydon, it's only 68% of people who've had first and second doses. So if you haven't had your COVID vaccination, please have your first dose. The offer is always there. Have your second dose if you've not had that. And then to have the booster. And Rachel mentioned the first and second dose. The second dose doesn't give you enough protection against this variant, but having the booster increases your protection. So follow public health advice, get vaccinated, and explain to people why you need to get vaccinated. And that's where the trusted information comes from, not from WhatsApp groups, not from social media. I think it's important that you have trusted sources of information. And the third message I want to get across is have hope. We're going to get through this. There's no doubt we're going to get through this. And even though there's a lot we don't know, there's a lot we do know. And we need to work with what we know, and work with all of you on this call and the public in general, in terms of what we can do to see the other side of this pandemic, but also this particular variant in the next few weeks. Yes, we're going to see some really difficult news. We're going to see more cases going up. We don't know whether that will translate into hospital admissions or not. We know that it's transmissible, so we expect there to be more positive cases. So I think it's about holding our nerve, doing what each one of us can do, support each other, support our families, and support people around us in our community, and have hope that we'll see the other side of this. And I have no doubt that we're going to get through this. So really, approach this in a positive way, rather than thinking, like chicken licking, the sky is going to fall on you. The world is not going to end. We're going to get through this, and together, if we follow the right advice, we will.
Thank you, Dr. Agnelo, and you've always been around to give very open and honest information to the public since we've been working with you for the last couple of years. Now, I hear you saying that we should face this in a way that we will get over it, and we have so far. But the public anxiety, I think, is something that we're sensing as community groups that definitely is out there. We advertised this yesterday in one day, and today there's more than 50 people in the room. I think just shows that people do have questions, and I'm hoping that we can field as many of those questions today, so that people can go through this festive period, the break, just being better equipped and knowing where those correct sources of information that you were talking about are. So our final panelist is Becky Board, who is the Associate Director of Operations for the COVID Response and Recovery. Becky, would you like to introduce yourself?
Thank you, and thanks for having me. Yes, as you said, I'm Becky Board, Associate Director of Operations at Croydon University Hospital, and I'm a midwife by background. I've been working with the vaccination programme since inception, and I gave the first vaccination to the first Londoner back on the 8th of December in 2020. So it feels like a long time ago, but like yesterday in some respects as well. And I think firstly what we have to say is we've achieved remarkable things, both in Croydon and in London, and as a country, as Agnelo has talked about. It's been a miraculous rollout of the vaccination programme, and it's enabled us to get to where we are today in a safer manner. We, as Agnelo said, we were expecting this. We know what viruses do. We know that viruses try and outwit us. They try and change. We have flu vaccinations every year. Every year that flu vaccination is slightly changed based on the previous year. And that's what's happening with COVID at the moment. So it's transmitting quickly with the Omicron variant. Our job now is to work together as communities to help slow it down. As Rachel and Agnelo said, we're prepared for this. We need to keep calm and carry on. We need to be sensible and follow the guidance. So what does that mean for us? Well, in the hospital, it means that we're looking at what's happening, who's coming through the front door, and how do we prepare ourselves to cope with that. We're looking at where our COVID wards are and how we care for people in the community who may be having, symptoms of COVID but don't need to be in hospital. And there are a substantial amount of people who will be out in the community living with COVID at the moment. We're also looking at how can we protect our communities, and central to that is obviously the vaccination programme. The biggest piece of advice that we can give is when you're out and about and in populated areas, please think about, are you at safe distance from people? Have you cleaned your hands recently? So regular hand washing, using the hand gels, wearing face coverings, and having your vaccinations are what's going to help keep us all safe and well. Thinking about the vaccination programme, we always knew that we would need more than one vaccination to create that immune response and to top ourselves up. It's quite normal that viruses try and change, and they try and be a bit clever, and they try and beat the vaccinations. And what we need to do is make sure we get as many people vaccinated as possible with the highest level of protection we can, so that we slow down the transmission of the virus. And Rachel talked about that line going straight up. We need to sort of flatten that line out and get it coming down. And by working together and making sure we spread the word, we will be able to do that. I think what's important as well is that after tonight, hopefully we will have helped answer some questions, would have helped create a sense of, okay, I get that now and I understand my role in it. I think we all have a duty then to go out and speak to people and pass on that correct information, and signpost to single points of truth like the South West London website, where you can go onto there and you can find out where are the facts and where can I go and get vaccinated. Certainly what we're seeing at the hospital is we're getting people coming through for their first dose. So this week alone, we have seen a significant amount of people coming through for dose 1, which is absolutely great. We had a lady who had been quite severely unwell with COVID, who had been in hospital for a significant amount of time, who she came to our clinic last week actually, and she said, I just wish I'd done it sooner. I wish I'd got vaccinated before I got poorly. Sadly, I had to get poorly to realise the significance of it. Now, her story was really powerful, and I have no doubt as she goes out and talks about her story, that will have an impact in the community as well. So our voices are strong, and we need need to make sure we use them in the right way. I'm conscious of time and the fact we've got questions to answer, so I'm going to pause there. Thank you.
Thanks very much, Becky. Really useful information there. So you're right, it's time for us to go to our community members for questions. So the panelists have given their introductions, and it's your opportunity now really to get your questions answered. So there's two ways of doing this. Either you can put your hand up and we will ask you. My colleagues in the room will point out who's the order of the hands, and you can ask your question directly, or you can write your question in the chat box. I can see lots of questions are starting to crop up in the chat box, so I'm going to ask my colleague Jo Austin to help me out here with some of the questions. Jo, do we have a question for the panelists?
Hello, yes. So there are lots of really good questions in here, and I can see there's quite a lot about the vaccine. So I'm going to have a little look through it and work out the order of those. But so to begin with, I thought I'd ask a question about testing. So somebody's saying that, is it true that when you have had a COVID infection, you shouldn't test for up to 90 days afterwards because you could get a false result? How are people supposed to adapt to the new world where having a proof of a negative test allows you kind of entry to places? I don't know, Rachel, would you be able to answer that? Or
yeah, it's really about science more than anything else. Is that and there are certainly out within the community generally two kinds of tests. There is the lateral flow tests, which are the ones that take 15-20 minutes to identify whether you're COVID positive or not. And there is the PCR tests, which are the ones which, depending on how fortunate you are, can take 24 hours to kind of about 48 hours, which is the test for the RNA of the virus. So actually, it's just the nature of the science of a virus. Becky, you described it beautifully in relation to this. Obviously, I've got two clinicians. Virology is kind of like certainly an area that I've been involved in, but I'm not a clinician, although I'm a director of public health. But actually, in relation to this, it's just the nature of viruses within some people. Is even though very early on with the infection, they very easily shed virus, they spread it around to other people, is that there are some people who still retain small fragments of the virus within their bloodstream, even though they are no longer infectious. So actually, my partner, I was explaining this to him today for exactly the same reason, is so that if you have had a positive PCR test, is that generally there's a recommendation that you don't have another one for 90 days because you might still be having the RNA, that's the genetic material of the virus within your bloodstreams. Generally, is that the evidence has shown us that within the 10 days, you do cease to be infectious, hence why the self-isolation. But there are some individuals who do carry small parts of the genetic material around this, so can continue to test for a while. There are some circumstances where it does make it difficult in relation to this, but generally, most of the information I've seen around this is either proof of a negative test or proof that you actually have tested positive for COVID and recovered. Both are around this as well. It's a little bit more complicated in terms of travel. But it is about, certainly, while we know vaccination is a really important part of how we are going to get a new normal around this, and hand washing, hands, face coverings are important. Testing is also an important part of what we do as well, actually, and certainly as people have been identified as contacts of people who are positive with COVID, is that whereas before people were told that they don't need to self-isolate, they have been asked that they need to lateral flow test on a daily basis. So there's quite a lot of, I mean, as Becky said, lots of information in relation to the testing on the South West London website, also the council website. It is very confusing. So if you're uncertain, go to one of those websites to see your circumstance. But basically, if you have tested positive of COVID, is that really you shouldn't have a PCR test for 90 days just because you might have the viral genetic material in your system.
Thank you, Rachel. Joe, do we have any other?
Can I just add to that? So if you haven't got symptoms, then you should do the lateral flow test. If you've got symptoms, then you should do a PCR test. I think that's really important to stress, because people have symptoms and they do a lateral flow test and it's negative, and they assume that they haven't got infection. So if you've got symptoms, you need a PCR test.
Sorry, I think that's really important, Agnelo, because this is why we're a team of teams really here, isn't it, Agnelo? Is that thing is that the lateral flow test is about 75% accurate in that actually it generally gives us about 75% will give us indication of that. It doesn't generally give false negative, kind of like false positives, but often it misses out. Sometimes people don't swab properly or don't use the thing as well. So I would absolutely agree with Agnelo. Is if you are unwell with the symptoms, the three kind of major symptoms, and they're not changed yet, get yourself PCR tested, because that is the way that we can actually confirm whether you're positive with COVID or not.
Agnelo and Rachel, when I applied for a PCR test, I was asked if I wanted a prick blood test as well. Can you shed some light on what that blood test might be for?
Yes, I had a recent PCR test last week, and I ticked yes, I wouldn't mind giving my blood, but nobody's contacted me yet. That's basically to check your antibody levels. So I think we know that if you've had COVID or you've had the vaccines, that inevitably your antibodies or your immunity is going to wane with time, and so that gives an indication of what the level of antibodies or immunity in the population is, and that's part of that epidemiological study that's going on.
And I do have to say, particularly in terms of the kind of group that we're speaking to, is that the blood and transport service, actually every donated blood also is used as well. So actually, and of course, in terms of donating whole blood, it's really important. So actually, that's another way that we can kind of find out around this. And it is about learning around this. But certainly, I would also, I know it's not quite, I'm off message around this, but anybody who hasn't thought about donating blood is able to donate blood. Please do consider it, because it's a really important thing for people to do within Croydon. Thank you.
Brilliant. Joe, back to you.
Hi, sorry, keep having problems coming off mute. So yeah, there's quite a lot of questions in here around clarity for the booster. So this one probably sums it up. Why is a vaccination needed if a booster offers greater protection? Becky, I don't know if you wanted to come.
Yeah, thanks, Joe. How it works, and in fact, I'm going to steal Rachel's analogy, and I think this is going to run and run and run. It's like building blocks. So Rachel talked about the first dose being primary school education, and the second dose being secondary school education, and then the third dose being a higher level of education, such as university. So if you think about that, your first dose of your vaccine starts your body off. So what that vaccination does is it gives your body the template to make the immune response that your body needs, the same as you would if you had the COVID infection, but it's not giving you the COVID infection. It's giving you the building blocks to make the immune response to create the antibodies to protect yourself. So you get the first dose, and that gives you a certain level of protection for a certain amount of time. You then have a second dose, which tops you up, which gives you even greater level of protection. So that's your building blocks are being built on. So you're more educated. Your body is going, okay, I've got this. I know what to do. I'm going to protect you even more now. And with the booster, it builds on that even further. So we're looking at over a 70% efficacy or way of the vaccine works with the 3 doses against Omicron. Now, I know that it's confusing because we were talking about kind of the 90% efficacy before Omicron came along, and that's because the virus is slightly changing. So the template that the vaccine gives you, if you imagine it being a template of a letter, and that letter doesn't quite fit completely this new variant. There's some bits that overlap, yeah, but some bits that they don't. So it gives you a level of protection for an amount of the new variant, which is around about 75% with your 3 doses. So the booster is topping you up. It really is needed. You might think, do you know what, I've had 1 and 2. I thought I was done with it. I don't want another needle in my arm. Just leave me be. And I can understand why you may feel like that, but I can't stress enough the importance of topping up what your body's made already, not letting your antibodies drop too low, topping yourself up with the booster as advised, so that you can protect yourself, you can protect those around you, and ultimately we can start to break the chain of transmission, get the rates down, and start to get back to some kind of normal.
Thanks.
Becky. And then do you think that we'll need another booster in another 6 months, or?
So I can say that if I was offered a booster, I would absolutely take it, because we know that a bit like the flu virus, okay, so we've had flu a lot longer, we've had flu vaccines a lot longer. Flu season tends to be around from September to March, and somewhere in that window you will be offered, if you're in an eligible category, you'll be offered your flu vaccine. And then it will come around again. You think, well, I only just had this. Why do I need it again 12 months later? That's because you're topping up, you're boosting the immune response to the virus. COVID, as Rachel says, we're still learning about it. There's new stuff every day. The evidence is continuing to come out. I think it's likely we will need to top up again, because that's how we're going to keep on top of the virus. We've already talked about how viruses change. What we don't want to happen is that the virus gets too clever for us. It changes too quickly. Its template is so different from the vaccines that we've got available that they become less and less effective. So by boosting and topping up our protection as a community now, we will help slow down the virus, and then keep the vaccines working.
Rachel, did you want to come in there?
I absolutely do, and I think that there has been some confusion throughout in terms of the fact that we use the term immunity, and people kind of hear the term immunity and think about vitamin D and zinc, and it's different. We're using different types. The immunity that we're talking about is a very specific template that is designed for the virus, that can only be actually provided by a vaccine. And actually, I think that, I mean, I'm going to kind of, let's do the ping pong. It is about teaching your body to learn how to respond to a specific invader into your body. So it's not a general thing about how you're feeling about yourself. It is something very specific, which means that actually when you get the virus entering your body, your system, preferably boosted up to university level, goes, aha, we know what you're going to do, we're coming and we're going to sort you out. And that is basically the immunity that we're talking about. So actually, while I know that people have said, oh, we've talked about vitamin D and zinc and other things, and yes, that might be, but and I think that this is a problem our side, because we are talking about immunity in a different way, a specific target, where actually the template, it encourages the body to recognize the vaccine as something invading our body, and actually basically tries to neutralize it so that we become less unwell. And that's the difference. It's just different terminology, and I just wanted to explain the difference in terms of that. Thank you.
Thanks. Okay, if it's okay, I'll crack on with some more questions. So this one's about Omicron, and obviously it's all new, isn't it? We're all learning a bit about it at the moment. But is it true at this stage the amount of people getting sick and dying is less with Omicron than it was with the previous Delta wave? And is it likely to become the dominant strain as it is now in South Africa?
Okay, so it is becoming the dominant strain. It is the dominant strain in London now already. It is absolutely becoming the dominant strain. And in answer to the question, we don't know. We're still trying to find out. It has come very, very quickly. We're in conversation with South Africa. I mean, by pure chance, is our Deputy Chief Medical Officer is of South African stock. So she was speaking to South African epidemiologists today. So we, one of the things globally we have come together to learn, but we really don't know. We are trying to find out. All we know at the moment is that certainly it is very communicable, and we're starting to see large numbers, as Agnelo said. And I think it's important, you know, kind of like, you know, in relation to this, we're not panicking. This is part of what virus is around this, but we still don't know. We suspect that later on in the next few weeks we might find out more. But right at the beginning of the pandemic, if you remember me saying, we were learning day by day. This is us learning day by day again.
I think the other bit to add to this is the reason for the concern is that if you've got a very highly infectious virus, then it's going to spread to a lot more people. And whether it's serious, it causes serious illness or not in those people, the numbers of people will be greater. So inevitably there's going to be some people that are going to be worse off than others. But if you've got a lot more people being infected, the chances of more people being seriously ill and need to go into hospital will be greater. And that's why we need to prevent the hospitals being overloaded. And the reason to prevent the hospitals being overloaded is if you've got only COVID patients in the hospital, then what about everyone else? You know, people with heart attacks and strokes and other serious conditions, they won't get the care that they need, and we need to ensure that they get the care as much as people with COVID. And important to say, and we didn't say that before, was that the numbers of people that are in hospital at the moment are predominantly people who've not been vaccinated. And those that have been vaccinated and had their booster are actually fewer in number in terms of hospital wards at this moment in time. So again, more evidence that actually being vaccinated prevents you becoming sufficiently ill that you end up in hospital.
That's lovely, thank you. So a question that I was emailed earlier today by someone who wasn't able to attend but asked me if I could ask you is that they haven't had their vaccine yet, they haven't had any, and they're a bit embarrassed about going to the walk-in centre to get their first one. What would you say to someone in that position? Is it too late now, or can they go ahead?
Don't be embarrassed, just go along, have your vaccine. And then have your second dose, and then have your booster eventually. So there's no time. The offer is there whenever you decide that it's the right time for you, and that you're happy to go and have it done, because you know you feel comfortable that the information that you've had is compelling enough for you to go and have it done. We're not going to force anyone to do it. I think it's important that we give people the right information to make the right decision for themselves.
Brilliant, thank you. And so this is a interesting question. So what's the difference between getting your immunity from getting COVID and getting over it and having the vaccine? Is there a benefit to one or the other?
So shall I answer this, or do one of you? I don't want to be doing all the talking.
If you answer and then we supplement, then Agnelo, if we need to. I'm sure we won't.
So when you get the COVID infection, your body responds to that by two elements really. One is in terms of antibodies, and the other is what's called T cells. And so that if you get exposed to the virus again within a certain period, you will be able to fight off the disease much more quickly. But with time, the immunity goes down, and Rachel explained what the immunity is, and the antibodies go down, and therefore you need to, using the analogy of school and primary school and secondary school and further education, that's a really good one. You're then building on that infection, building on that immunity in terms of building the antibody level out up to fight if you get exposed again. And so it's important that even if you had COVID and you have to wait at least 28 days before you have your first dose or your booster dose, or your second dose, whichever dose it is, then it just builds on the immunity, because the immunity will wane with time. And for that reason, it's important that we have first, second and booster dose at this moment in time for Omicron. In the future, they might actually devise a vaccine that is much more specific to the Omicron, and that'll bring it up to 90 or 95% as we've had for Delta up to now. So future vaccines might have that, but at this moment in time, with the vaccines that we've got sufficient protection of at least 75% against Omicron. So doing the best we can with what we got.
Brilliant. And I just wondered, I'm going to move on from vaccines in a second, but I just wondered if you you could just tell us a little bit about who can vaccinate and what sort of safety measures are in place for if people have side effects or whatever afterwards. Thank you.
Should I talk on that, Agnelo, give you a little rest? Firstly, we don't do anything that's not safe. So the vaccine programme is very tightly controlled, as is any healthcare setting. So we may be out and about, and we may be in your local church, we may be in your local school, we may be in your local sports centre, or it might be in a hospital setting or a GP surgery. But something that doesn't change is the safety measures that are adhered to in each of those settings. And the level of training in which people have to have in order to contribute to the vaccination programme. So you may have heard that people talk about registrants, so that will be nurses, pharmacists, doctors, midwives, people who are on a professional register in healthcare who are helping the vaccine programme. And they may be doing things like taking your medical history, your consent, talking to you about the side effects, and they may be mixing up the vaccine, they may be administering the vaccine. And they do so because they're appropriately trained to do every stage of that. They've had the appropriate basic life support training, anaphylaxis training, safeguarding training. They've done Health Education England training modules. They're trained in the vaccination, both in the technical aspect and in the background and everything that's contained within the guidance. You've then got people who are not on a professional register, so they're not what we call registrants, but they are trained professionals. So they are people who maybe have worked in other fields, who've come to the vaccination programme, who've been trained as a vaccinator. So they may be from the St John's ambulance. We've had people from the airline industry who've retrained. But nobody is allowed to contribute to the programme if they haven't been through all of the appropriate training. So that is everything that I've discussed. So anybody who vaccinates must have undertaken the Health Education England online modules. They've had face-to-face training. They've had technique training. They've been observed before they're allowed to practice without direct supervision. And they also have to continually have that updates. So we've been running the vaccination programme now for over a year. We've got people that have been doing so for the whole year. So every year they have mandatory updates on things like basic life support, anaphylaxis training, etc. So we absolutely just don't let anybody into the programme. We have to make sure that we follow the strict guidance, and that is throughout every single setting, throughout not just Croydon, but the country as a whole.
Lovely, thank you. And then there's some questions about aspirating needles. Do you know anything about that, Becky, that you could, to prevent side effects?
So you don't need to aspirate the needle with the vaccination. It's not part of the technique. If you actually look at the Health Education England training package with the injection, that's not something that is advised. I haven't seen the specific question for the specifics of it, but what I can say is that nobody would be giving a vaccination if they were not trained to do so, if it was not appropriate for them. And we also have vaccinators who are trained for specific cohorts of people. So we administer vaccines to lots of different age groups and lots of different backgrounds. So what's really important is that, for instance, if we're administering a vaccine in a child, that we do so from somebody who's appropriately trained and used to vaccinating children. Equally, we make sure that we've had quite a lot of people through certainly the hub that I run with learning difficulties. And actually for them, it can be quite distressing to come into an environment that's not familiar with people they don't know, to receive a jab in the arm. So we make sure that we set aside some quiet space. We do make sure that we've got somebody with them that they know and they feel comfortable with, so that we're able to give the vaccine with the minimum amount of stress to that individual. And we also always make sure that we do so with informed consent. So it really is a safe and appropriate process.
That's great, thank you very much. So I'm going to move on from vaccines for now and talk about schools. So it's a bit of a two-part question. One is it correct that the spread at the moment is mostly within schools and then children bringing it home to their families? And if so, why is the government adamant that they want to keep the schools open?
Okay, so I think that's me then. So I am a Director of Public Health. I cannot respond on behalf of Her Majesty's government, who will have their own opinion around this. And I think the honest answer is, well, no, it's not true. Is actually in relation to this is that while I'm seeing transmission in children and in schools, I'm also seeing sizable amounts of transmission in 40s and 49-year-olds. I made reference to my, sorry, I've had so many conversations around this. My partner has COVID, so can't get his booster today because he has to wait for 28 days. And my 28-year-old son, who has been boosted and jabbed, actually is COVID positive as well. So, and he doesn't live in Croydon, but he lives quite close to Croydon. And one of his mates lives in Croydon. And I think there are now 35 of his friends who are now positive. So they're all in their 20-somethings. So what we think is happening, and I think the thing is, in relation to this, it's a bit like, let's not be ashamed if we haven't had our jab. Let's not shame people for having a communicable disease. This is something that's really infectious and we can't tell. Lots of people don't have around this. So I am seeing large numbers within schools. I'm seeing large numbers within younger people. I am seeing increasing numbers with over people as well. Part of it is that some people have COVID without any symptoms at all. So the thing is that as Director of Public Health, I am keeping a very close eye on where we are. The other thing as well is that although we do have extensive testing, is that because some people don't get some symptoms, don't test, and some people have symptoms, don't test, we don't know how many cases are at the moment. So, and what I have been doing with the head teachers and the Director of Education from the beginning of the pandemic is having regular conversations with schools. If there are outbreaks within schools, and if there are teachers who are having to self-isolate, we're looking at alternatives around this. And in fact, today, the Director of Education and I have been in communication with head teachers whose schools may continue until next week, to saying perhaps they could consider maybe not having the schools next week. But the reason why, as Director of Public Health, I've been desperately trying to keep the numbers down is that we need to have face-to-face education for our children. Their education has been so disrupted by COVID so far. So we are working in this space. But I think the thing is there is no single source of infection within COVID within the community. All age ranges have the potential to spread it. So actually, in relation to this, hands, face, space, and vaccination, and we are doing, I say we, Royal we, Agnelo and Becky and others are vaccinating younger children as well. But actually, what I'm seeing at the moment is it's predominantly adults that are spreading around the community.
The other point to make about children is that it's not just a disease, because they can still get long COVID, which is a more debilitating long-term sequelae to having a COVID infection. But they miss school, and missing school and their educational attainment has a profound effect on children's lives. So it's really important that we test regularly in schools and we carry out all the measures to try and prevent becoming infected. And the other point to make is that children at this time of the year get mild, minor illnesses as well. So I think, somebody put in the chat about, would a cold be a symptom? It's not one of the 3 cardinal signs of COVID, but there is increasing evidence that they might get mild illnesses from sore throats to a cold, and it's certainly worthwhile doing a PCR if they have that, and even if their lateral flow is negative. So remember, we said if you've got symptoms, then you ought to do a PCR. If you've got no symptoms, to do a lateral flow test.
And one of the things, sorry, one of the things I would say, and I would report, is that all of us, I'm the daughter of a teacher, tend to kind of like go, oh, it's okay, it's nothing but a cold, you can go into school. Actually, it is something communicable. So actually, in relation to this, and I'm smiling because all the parents around this, if a child is unwell, kind of our child should not go into school because a child can infect. It doesn't make any difference whether it's COVID. We also have norovirus going around schools as well. And actually, it is inconvenient for parents and carers, but actually, this is how we stop a communicable disease, by people who are unwell with colds not actually going into school or work.
So when we're talking about symptoms as well, so I've read this in the news and someone's asked me, in the chat, when are the symptoms of Omicron different? Should we still be looking out for the same thing, or?
And actually, I've been at a meeting today, so we had the discussion as well. So the nature of this virus is that it is syndromic. So actually there isn't one kind of like one specific level kind of indication of disease. So very, very early on, a whole load of scientists, clinicians, epidemiology looked at what they could see in terms of clinical presentation. And this is reviewed on a regular basis. Actually, thinking about it, Agnelo, you're probably involved in this, but anyway, is that actually in relation to this, although you will hear, oh well, if so and so has such and such, but actually at the moment it's high temperature, it's a new persistent cough, it's a lack of smell or taste around this. And actually, at the meeting I was at today, directors of public health were asking, are there going to be different indicators? And actually at the moment, no. Omicron is still a variant of the same thing. It is syndromic, different people present in different ways, but generally these are the areas to do this. And the reason, the rationale around, particularly, I mean, Agnelo will say this as well, particularly around winter, is there are lots of things that present as a runny nose. There are lots of things that present as and actually it makes it kind of more complicated as well. So I was told today that at this stage, although they're reviewing it, they don't think they're going to add any additional clinical. However, I know that clever clinicians like Agnelo and others will be seeing this, but in terms of the actual definition that you'll hear from government, it isn't. And the reason is because there is lots of different syndromes. However, what we know within children is often the case is that it can present as an upset stomach, because children often do present with upset stomachs when they're unwell.
Lovely, thank you, Rachel. So I can see that Andrew's put his hand up. I think is that you, Andrew? Did you want to say
yes.
Something?
Hi. Yes. I just had a text in, everyone. Football matches. Should football matches now be cancelled? So this particular person went to a football match yesterday. They were told before they need to do a lateral flow test. They need to go on their website and do a group booking. When they actually went to the match yesterday, they were just allowed in with another 35,000 people without being checked. Why are we doing all of this stuff if actually you can go to a football match with 35,000 people and actually not asked to see anything that you've potentially done?
So I can answer that. Palace Southampton last night, 28,000, I think it was, in relation to this. So
about that.
No, it was. So in relation to this is that throughout the pandemic, Sarah Quinn, who's head of environmental health, one of my directors in public health, have been working very closely around all kinds of activities, including football matches. The Premiership League actually worked with all directors of public health So my mate Matt Ashton, because he's Director of Public Health of Liverpool, has got 2 Premiership leads around this. So actually what we agreed in relation to the process, that 100% of everybody who went into hospitality, so those people were actually contained, not outside within Selhurst Park, but contained within the room. All of them had to present that they had a lateral flow test. Actually, the spot checks that they did do demonstrated that actually those people were there, had a lateral flow, negative lateral flow, or COVID vaccinations as well. The third thing is that actually when we do the test and trace, is that people identify where they think they caught COVID from. So every football match I look at, you know, with a fine tooth comb to see whether they have caught COVID within, well, not just Selhurst Park, but anywhere else. And we've got very low numbers considering the large number of people who come around this as well. And I think this is about how we work as normal. Actually, you talk about Selhurst Park, but we've got a box park Fat Boy Slim this Friday as well. So we're working very, very closely to try and reduce this as well, while making sure that the economy doesn't tank. So I think it's getting a balance between good infection control. I mean, obviously people will know that with some Premiership players have actually caught COVID, so can't do this. But rest assured that actually any large event that's happening within Croydon, myself and my environmental health colleagues are very actively involved around this.
I think it's important to say as well, whatever you do, wherever you go, you can only minimise the risk by all the precautions. You can never eliminate the risks, and so we've got to be realistic about it as well. If we want to do the things that we want to do, and it's important to us, then we've got to take all the precautions. And I think Chris Whitty made the point yesterday, is actually how important is it for you to go? And you know, if you're a football fan and your team is playing at home or it's in an important position, that's really important to you. So, you know, take the precautions that you can. I think the football clubs have to do their bit on that as well, in terms of making sure that they check.
Lovely, thank you. I just wanted to remind everyone that if anyone else, I can see, is there another hand up? Does someone else want to come in and ask a question? Sorry, I can't see who it is. I'm just scrolling through.
Amelia.
Amelia.
Oh, hello, it's Jason here, Jason Chapter, Lakeside Nursing Home.
Hi.
Sorry, my daughter ran my laptop. I have a question for Dr. Agnelo. Can you have the Omicron variant and Delta variant at the same time? And if not, why not? And if that is the case, and Omicron is not as virulent or not as dangerous as the Delta variant, if that becomes the dominant variant, would that not act as a natural vaccine?
So the first thing to say is we don't know about the Omicron yet. It's too early to say. And the second, and Rachel started her comments by saying we've got a dual epidemic or dual pandemic going on here, with both the Delta and the Omicron. So there's no reason why you can't be infected with both of those, but we don't have the evidence to suggest one way or the other at the moment, because it's too early to say. So, but the measures to protect yourself and prevent you getting either are exactly the same. So it's immaterial really whether you've got them both or if you've got one of them. You need to try and prevent yourself getting infected in the first place.
But I would actually say that the questions you are asking are the questions that we're asking nationally as well. I mean, these are the kind of things we genuinely don't know, but actually in the meantime, as Agnelo said, there are things that we can do to protect ourselves around this. And the single most, and it's evidenced in terms of what we have seen around the globe, is actually having 2 jabs of a vaccine and a booster jab. And I think the thing is, while I understand that you know, other people are looking back and thinking, well, I'm not sure, is that the data that we've seen is actually very, very conclusive, that it protects people from serious ill health and death in a way that nothing else does.
Thank you. So I'm just looking, I'm going to join two questions up together, both from Lisa, and it's back to vaccines. So what are the stats for people who've been vaccinated getting the new virus? So I don't know if it's too early to say yet, but possibly you do know. And then how many vaccines are we going to have to take in terms of boosters? I think we kind of answered that earlier, didn't we, that we're not really sure. Will it be that every time there's a new variant, people need another booster?
Could you also first, sorry, I'll be honest.
Sorry.
I'll be honest, I won't lie, is that my partner's just asked me something by phone. I was distracted, sorry, I apologise, that's very rude of me.
That's okay. Maybe it might be too early to say this yet, but what are the stats for people who've been vaccinated and are getting the new virus, the new strain?
Okay, well, and I think the thing is, in relation to this, is not, we don't know the stats yet, but actually what we do, and I think that this is for people like myself who work around population health. I mean, Agnelo and Becky, I mean, this is the stuff that we deal with, and it can sound a little alarming around this, but even with 2 jabs and a booster, is that there is sometimes something called, like virus escape. I have used the analogy of a Swiss cheese, the ones with the little holes. And actually there are multi-layered ways of protecting people, but actually there will be some people where the holes all line up and the virus goes through. So actually, even with Delta, we are seeing people who have been kind of like had all 3, either three jabs or 2 jabs and a booster, who still get COVID. But what we see them getting is much a milder version in relation to that. So we've seen that happen in Delta. At the moment, we have really only had Omicron within London in this last week, so we still don't know. We suspect it will be kind of like something kind of similar in relation to this, but actually all the evidence is pointing out that at least 3 jabs will make the difference to turn something what could seriously damage you, and you end up in hospital or pass away. And actually there are some dreadfully sad stories across Croydon, across the country, around people who have including kind of like I said earlier on, one of my friends has got a 27-year-old son who passed away. Now so we are still hearing these stories around this. So actually in relation to this, is we are still learning, but all the evidence shows we don't know if there's going to be a vaccine for each virus. But what we suspect, I know Becky and Agnelo have said this, what we suspect, like flu, actually there's probably going to be an annual top up of the immune system for most people, and with this is not unusual for this kind of thing. We have this with seasonal flu.
Can I just come in there, Rach? I think I agree, and I just want to add a little bit of context from my perspective, really. I was on the COVID wards in wave 1. I have been working in the hospital, and I saw what we were like before we had the vaccines, and I don't want to go back there. It wasn't pleasant. We didn't have what we have now in the vaccine. What we are seeing at the moment is we are seeing increasing amount of community transmission. We are seeing cases that we talked about earlier in this webinar, going up at a straight rate. But what we're seeing, whilst hospital admissions are starting to creep up, it's winter, we've got a virus circulating. That's not a shock that we're seeing that. We're prepared and we're getting ready for what's coming next. But what we're seeing is that people who have taken up the offer of the vaccination are significantly better off than those who have not. So it is not 100%. So having the vaccination does not mean you will never get COVID. What it means is you are less likely, and if you do get COVID, you are very well placed to not get severely ill, to need hospitalization, or even to pass away. So that is the significance. What's really, really important is that we know that vaccines are great and they are helping us, but we're also seeing that people who are testing positive, who've been vaccinated, aren't necessarily presenting with the symptoms, the classic symptoms. So we're seeing a much lower level of acuity. So you could argue that what's happening is people that are vaccinated are feeling the benefit of that level of protection. So whilst they're still unfortunately catching the virus in the community, because we've talked about it's so transmissible, there's so much of it circulating, they're actually quite fit and well with it. They're having mild symptoms that, you know, on another day outside of a pandemic, you might think, oh, I feel a bit off today. I might take a few days off of work, but on the whole, I feel okay and I'm going to be okay. That's where those people are landing. On the other end of the spectrum, the people that are not vaccinated, and the data speaks for itself. This is a Southwest London and national picture. People who are not vaccinated are faring worse against the virus. They are needing more hospitalisation and they are needing more intensive hospitalisation. Within that, we've got at-risk groups, and we've got groups that we know are disproportionately affected by COVID per se. So thinking about women from a Black background who are pregnant, we know that they're already 5 times more likely to die during pregnancy and childbirth. So what we are saying is absolutely, please, 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 let's not add COVID on top of that. Please protect yourself, protect your baby, the people around you, and take up the offer of vaccination so that you don't fall into the category of needing hospitalisation and being, you know, very, very poorly should you be unfortunate enough to catch a community transmission of COVID.
Just before you come in, Jo, just before you come in with the next one, just a reminder that we're nearly coming to the end of the session. So if our panelists could keep the answers concise, because we've got lots of questions coming through, and I think we've got a few hands still up.
So I was going to ask one question quickly and then go over to, because I can see there's quite a few hands up, isn't there, which is really great. It's nice to hear other people's voices. The question I was going to ask, which I think will be a quick answer, is it better to have the flu jab before you have your COVID jab, or the other way around?
You can have them together.
Ooh.
So you can have your COVID and your flu vaccination at the same time if you so wish. They're equally as important. What I would say is don't delay being vaccinated. Please, please, please go and get your jabs.
And so does it matter? It doesn't make any difference which one you have first?
No, it doesn't make any difference. What we'd say is that, you know, have them together if you choose to. If you choose not to, if you make a decision not to have them, then you know, just don't delay getting the other one.
Brilliant, thank you. Thanks, Becky. So I can see, Jay, you've had your hand up for a little while, haven't you? Did you want to come in?
Thank you, Dr. Agnelo, Becky, and Rachel. Becky, I just wanted to follow up on something you said the last bit. Do you think in hindsight, the booster jab or the second vaccination could have been done much quicker in between, taking one and the second one and then the booster? Would that have helped?
It's a tricky one. As we say, you know, we have to follow national guidance. So, you know, our hands tied in that respect. If you're looking at the science of it and you're looking at the epidemiology and what you're trying to achieve with vaccinations, there's pros and cons of both. So what you're trying to do with vaccination is you're trying to protect people, trying to protect the most at risk, and you're trying to roll it out as quickly as possible in a sensible way. So I can understand why the decision was made to elongate the gap between doses, because actually what you did at that time was one dose against the variants we were seeing at that time, gave us a good level of protection, and it meant that we could get round to as many people as possible, as quickly as possible, and get them protected. So that made good sense. What we're seeing now is that the virus is slightly changing. We need more of the vaccine to get the same level of protection. So we've had to up the ante. And you'll have seen the activity that's being spoken about, and the amount of capacity we've got within Croydon for vaccination. Certainly within Croydon, you know, we've doubled our ability to react to this new ask, and we're giving out more vaccines than ever. I hope that answers your question.
No, it does. And just to remind, if there are lessons to be learned, obviously we're not privy to some of the information you guys get, but if there is any learning to be done, we don't know what's going to be the next one. And I don't particularly feel, though, that we have now got pre-vaccination done. This is going to go away soon. So from a personal point of view, I just want to make sure that there is something around either in the next 4 months, 6 months, whenever I have to take it, the next booster, if you like. But you're right. And I think following on what Emma said earlier, when she was asked at the PCR test, a little prick to take a blood sample. I mean, if we can do that for the community members as well, in terms of taking the blood sample and measuring their immune system, we might identify people that have low immune system to be vaccinated probably at much shorter interval rather than people who have a strength in terms of their immune system from their personal perspective, like as far, because everybody is different, as you know.
They are indeed, yeah. I hear what you're saying. Logistically, I think the way the vaccine programme has been rolled out means that we can react quickly and protect as many people as possible. I hear what you're saying about checking people's antibodies levels before we offer a vaccination. But what that would do would put pressure on the system and slow it down. But I hear your point.
Yeah, I think it can be taken up with the GPs if possible, or the pharmacists, whoever else can do it, rather than the vaccination centres. But
The thing we have to be careful with the looking at the antibodies is that not all antibody tests are the same, and so not all antibody tests will look for the spike protein that's created from the vaccination. So that gets into a very complex mechanism. So it's not always as straightforward as my antibody test says that I haven't got any uptake from the vaccine, because actually if it's not testing for the right spike protein, it's not going to tell you what you want.
No. Nor is it going to tell you about the T cells, because that's really important as well.
And I think the thing is, in relation to this, is that one of the things the NHS has been marvellous is about absolutely doing this at scale, and it needed to be done quickly. So actually this is about doing it quickly. Anything that kind of slows it down. So you already hear the reason why it isn't around this. And it may well be kind of like next year we might find something a little bit more sophisticated. But until now, this, I think, is clinically safe and proven to actually protect the people in a way that actually means that lots of people can be protected quickly.
Thank you. Can I just stop it there for this particular part of the conversation, because I know that we've got some more questions to go through, and I think I saw Sue McVicker's hand was up for a while.
That's right, yeah. Sue and Shalana.
Yeah. Sue, you there?
Hi, yes, I am. Hi. I was just going to really ask a question about older people. At the start of pandemic, it was really elderly people that we were so very, very concerned about, and then clinically shielded people. And I'm not really hearing that, they are. Is it because lots of them have had their boosters and they're staying at home and they're relatively safe, and we're not seeing them being admitted to hospital and becoming severely ill like we did at the beginning?
So there's two things on this. First of all, yes, it is because of the boosters, and they're better protected. In terms of the shielded, so we're going to be launching something to do with the monoclonal antibodies and the medications. I think this Thursday, which is today, sorry. And essentially, the people that are shielding will get a letter. If they get symptoms, then they contact their GP or 111, and they'll be assessed and be referred urgently to a centre in Southwest London, would be St George's, who will then assess them for monoclonal antibodies or for medication. So we know that they're more immune deficient. Therefore, it's really important that they get additional treatments sooner, and that's something that's already going to happen, and which is really positive, because we know that people that have got weakened immune systems have to have a third dose, but also a booster dose. And so we've been working on those as well at the moment, and those housebound have been trying to get them boosted or having a third dose. The difficulty about rolling it out has been we've been working with the Pfizer vaccine, and until yesterday we had to wait 15 minutes. So we've got temporary change in the guidance, allowing us not to need to wait 15 minutes for the Pfizer vaccination, which is not a permanent change, but it's an operational change for now, so we can get the vaccine out to as many people as possible. But that's been what the limiting factor has been up to now in terms of getting all the housebounds done as quickly as possible. But I think the target was to try and get them done by the end of this week or beginning of next week, I think. Isn't that right, Becky? And the district nurses in Croydon have been really busy trying to make that happen. And certainly in Croydon, GPs through their PCN sites have been going into care homes as well, and doing that as well in terms of boosters. So we've been working really well on that. Remember, we've got over 120 care homes in Croydon. So it's been a major task to have got the first dose, the second dose, and now the third dose as well. So all this happens in the background, and people don't realise the immense amount of work that is going on to try and protect as many people as possible, and different members of the NHS, whether it's GPs, whether it's district nurses, community services, all involved in trying to do this. And now with the shielded group, it'll be the specialist centres as well that will be involved, trying to maximise protection for all the vulnerable.
Thank you.
I'm conscious that we're starting to run quite low on time, aren't we? So I think it's Shalana. Did you have your hands up to ask a question? So,
thank you. Good evening, everybody.
Hi.
Thank you. I just wanted to say there's quite a few questions and quite specific questions that people have, and I think maybe answers to them might bring a bit more reassurance. Is it possible for those specific questions to be answered in written form, just so that we can go back and feel a bit more reassured?
Yeah, of course. I was just thinking the same thing, and actually I can see that some of them can kind of be a bit grouped together, can't they? Because they're asking similar things in different ways. But yeah, I'll have a look through those tomorrow and try and get some answers out to you via Asian Resource Centre. It might take a little bit longer than it sounds to get it all to, you know, have it double and triple check just to make sure that it's the correct up-to-date information. But I will try and get that done this side of, well, in 2021, shall we say? Hopefully next week at the latest.
Thank you, and we will get those answers out in a mail shot once we've received those, so that it can be of benefit to everybody who's been at this session and the wider public. So we'll do it as a sort of question and answer paper. I think, Joe, you had one final question around dying.
Yeah, I was just going to ask, there's one question here around hospitalisations and deaths of COVID amongst vaccinated people. Is that something that anyone feels you know, able to talk about? So how many people are in hospital that are vaccinated, and you know, how many deaths are there?
That ties up to the question that Barty's asked as well. So in terms of figures for Croydon, I think there's about 68 people on the wards at the moment.
Yes.
With COVID.
It's about that, yeah.
And 8 in ITU, yeah.
And across Southwest London, it's about 240 or something like that. Now, if you look at the graphs across the age groups, you will see that those that have had their vaccines and their boosters are actually in a huge minority. The far excess numbers of people in hospital are people who have been unvaccinated. And I think that's a real critical point, because it's a fact that the vaccines actually help. And that goes across all the age groups, and particularly the middle age and the older age groups, but actually all the age groups.
And adding to that, I mean, for those people who didn't get to see it, but certainly across England, and looking at a large number around this, in terms of not just hospitalizations, but deaths, it is exactly the same thing as well. There is really clear data in relation to that those people who have received vaccination at all ages and this was looking at 2 jabs, because we're still working around this, are significantly likely not to die than kind of like people who have. So actually there is, I mean, and I know that many people were saying we want to wait to see in terms of the, you know, the evidence. I mean, I always feel thrilled kind of like knowing that Becky did the first jab within Croydon. I mean, that's just so exciting. We are now over a year on. We have a year's worth of evidence, and it is really categorically clear that vaccinations saves and has saved many people's lives. And we know that because we've now got clear evidence that those people who weren't vaccinated are significantly more likely to die of COVID than if they hadn't been vaccinated. A year of data now.
Thank you,
and that's
Rachel.
not only in this country, but all over the world.
Yeah.
I think the other point to make is, in terms of people of different ethnic origins, the population with the highest vaccination rate are white people, and the next highest is in terms of people of Asian origin, but we still lag behind. It's about 95% for those groups. We still lag behind in people of black origin, whether it's Caribbean or African origin. And I think Croydon is around 70% still. And so really, we need to get information to different ethnic groups to help them make that difficult decision that they've not even had their first dose yet. And I think it's only by getting the facts across to people. We know that getting facts across to different people through different avenues. So we had people from Bangladeshi origin that were lagging way behind in terms of vaccination, but by getting messages across to them through different means, faith groups and different community groups, their vaccination rate has gone up almost with the maximum number. So we know that can be done by giving people the right information to make that decision. So I think, you know, as the WHO director says, everybody will be protected when everyone is protected. And really, you know, we need to get even what's called herd immunity. We need to get substantially more people vaccinated than we have now. And London lags behind, and Croydon lags behind London.
Okay. Thank you very much, Dr. Agnelo. I'm going to have to stop everyone there, even though I know there's some really interesting conversation actually going on in the chat. And I no doubt we'll all carry on talking about this for the coming weeks and until COVID is over. I do want to give my speakers a chance to give a concluding 1 minute to round up what their final thoughts on this. But before that, we do have 2 polls to do, so I want to quickly do those polls. Please do bear with us. We probably will run about 2 or 3 minutes over time, but we're ending as strong as we've started, which is incredible and just shows the importance of the session. So the first poll that's coming up is, do you feel more informed about the latest COVID-19 news? You had that question at the beginning of the session. Let's see if things have shifted. Now, let me give you a caveat that more people are answering the question now than they did at the beginning of the session. So the figures, when we do publish them, may look slightly different because of the ratio. It looks like at the moment that people do feel more informed. 67% feel more informed, 20% feel a little more informed, and 13% don't feel any more informed than when they did. If you do have specific questions, write them into us and we will get them answered on that paper that we will be publishing. And then the second question on the poll will be, will you be getting your COVID-19 booster vaccination? You've got a choice of yes, had it already, yes, not sure, no. How are we doing for that? It's looking good. Right, we've got a few more people too. So 100% of people have answered, and it looks like that 66% already have had it. Yes, another 17%, so that's going to be boosted up when they've gone and got theirs. People are sitting on the fence, about 3%, and there are some people who are definitely saying no. It'd be really interesting to know why you're saying no. If you want to put that in the chat, why you definitely just would not have the vaccination, or if you want to write into us, then we can send those on to our doctors and our public health specialists to understand, get a better understanding of why people are still anxious, or why people definitely feel they don't want to take the booster. Now, let me wrap up by giving my speakers a minute each to give your final thoughts. We'll start off with Rachel Flowers, please.
Thank you very much. So I said this in my Director of Public Health report video this week. At Croydon, you are and remain magnificent in relation to the pandemic. We've come together very much to support all the people we care for within Croydon. So hands, face, space, replace. Wash your hands, wear face coverings, don't be overcrowded, absolutely use ventilation, but most important, vaccination actually makes such a difference in relation to this. I'll give you a personal story. I have been with somebody who's had Omicron around this. He's been quite poorly. I've been kind of like, and he was infectious before I knew around this. I have not caught COVID. I am still COVID free in relation to this. So actually in relation to, it does provide protection in relation to this. Like I said, I've had lived experience around this. He was poorly, I was jabbed, he was not.
Thank you very much, Rachel. That's a really strong message. Dr. Agnelo.
Thanks, Ema. I think when the pandemic started in March 2020, we knew very little. We knew very little what to expect, but we're a long way down the line now. To reiterate, it's not a time for panic. It's a time for what can we do. The NHS can't solve this. We have to solve it as a community. So the NHS can help try and get the vaccination program up and running, but it requires two to tango, as they say, and it requires people to be willing to come forward to be vaccinated, and at every opportunity, whether it's booking online on the COVID vaccination site, or if your first language is not English or you can't use the internet, is to go on 119. And certainly the opportunities are there. I think as a community, we came together, and I would urge everyone to watch Rachel's Director of Public Health video. It was so poignant and actually brought out the best of Croydon in terms of what we had to go through that first wave. And society, the community came together really well to support each other. And one of the greatest lessons for me during that time was that our community partners actually were the answer to a lot of the questions that we couldn't answer. We couldn't get the message out to people. Our faith groups, having been to Christian churches and mosques and been on television in terms of some of the groups, trying to get those messages across has been really an eye-opener. And that's reiterated the point, we're all in this together. And as long as we work together on this, both the NHS and the community, then we're going to get over this. And as I said, I'm positive that there'll be better days ahead.
Thank you very much, Dr. Agnelo. A very positive message at the end. And we've got Becky, your final thoughts, please.
Thank you. So my final thoughts are obviously reiterating what Rachel and Agnelo have said. I can't stress it enough, but I think from me working in the hospital, what I want to say to you is, please don't be one of the people who come to us on discharge and say, I wish I'd been vaccinated, or worse, in ED, because we have it and we see it. People come through the emergency department and they're really, really sick with COVID and they say, can I be vaccinated now? And it is heartbreaking to say, I'm really sorry, you can't be vaccinated at this point because you've got COVID. We've got a weapon, we've got the vaccine. As Agnelo said, we didn't have that in the beginning. We've learned lots. Let's take what we've got, let's use it. We know vaccines are safe. They are effective, they are working, they are helping. For them to continue to do so, we need to work together as a community to help break the cycle of infection. So the hands, face, space, ventilate, vaccinate. That's what we'll need to do. We've been doing it all along, we'll continue to do it, and we will get there. So please, 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 If you're on the fence, if you're sitting there now thinking, do you know what, there's something there, I feel like I need to know a little bit more, I need a bit more digging, that's absolutely fine. That is respected. We want to give you the answers. Please make sure you come and seek out that information. Please visit the reputable links. So I'm sure we'll link to these as we communicate through, but the South West London website, nobody is going to turn you away for a vaccination. So if you decide to, you know, tomorrow morning, do you know what, today's the day I'm going to go and get my first vaccine, don't delay, go and do it. People will welcome you, and we will thank you. So I'll end there.
Thank you very much, Becky, and you've done well to promote the hands, face, vaccinate and ventilate, as you said, the two more V's to our vocabulary. Joe, do you have any final words?
No, I just wanted to echo what everyone else has been saying, and you know, marvelous, amazing community partners that can come together on 2 days' notice. And thanks to the panel, and thanks mostly to the community for your really interesting questions, really thought-provoking, and yeah, thanks for coming and spending the evening with us.
So again, my thanks to everyone that came today, and thank you to everyone who's been giving me best wishes. I've received lots and lots, and I'm very, very grateful that I have such loving and caring people around me that keep asking me to look after myself. There are plenty of people who this Christmas will be isolated and won't have that love and won't have that care. Spare a thought for them. If you can help, do help. If you can reach out to people, even if it's a telephone call, that can make the difference between the well-being of someone and somebody actually being really poorly and upset over Christmas. So all I would say is thank you very much. Please listen to the messages. These are the experts. We won't get them around in rooms this often, so it's really important we utilize those times that we do have them. And as community groups, if we can support that, my thanks to my community partners again, Sue McVicker, I can see you pop up on my screen, Andrew, who's gone, and CVA as well, for all the hard work that's happened over the past 2 years. Next year we'll be back again, no doubt, doing this again, but for this year, thank you very much, and have a good one.
Thank you very much. Good night.
See you soon, everyone.
Right.